Get them all clear, but I didn't change my mind. That's all right. That's all good. Can you pause it? Yeah. Sorry, can I just move this around? Because I think there's interference between, because I've got no noise over there, and then when I come over here, there's noise, so I'm just going to move them quickly, sorry.
Okay, Matt, next time we'll bring our mic stand, eh?
Sorry, is anyone on, do you guys know what channels you're on? Because I'm getting like a fair bit of,
Got no interference at all.
Yeah.
I've got none either.
I'm on 50.
Mine's on screen.
I was going to say, if you can't resolve it, I'm sure we can continue.
He's live at the moment, so he's connected to guys.
Sorry, man. It's just no noise there, and I'll put it there. Yeah. The mic's fine, I don't know where it is.
Give it to you.
Good morning, everyone. Joined this morning by the Deputy Premier and Health Minister, along with Dr Veach, Donna Adams, the Deputy State Controller, and also Catherine Morgan-Wicks. I'll provide an update of where we are and talk about a couple of initiatives that we're going to speak about today. Jeremy will then provide some further detail, Dr Veach, to take any detailed questions and then revert back to whoever is most appropriate to answer your questions. So, first, if I could just start by saying that since the start of COVID, our priority has been to keep Tasmanians safe and secure, and that remains our number one priority. The Delta strain, though, has changed things. It seriously impacts the lives of those living in New South Wales, but also Victoria and Queensland at the moment. Over the past 24 hours here in Tasmania, another 1,263 laboratory tests have been undertaken, and I'm pleased to say that again there are no positive cases that have emerged from that. This is good news, and as we near the end of 1 week since that incursion last week, we are now optimistic that the processes that we've had in place have worked, and obviously we'll continue to test, but our optimism increases each day that we won't see a further case arise as a result of that particular matter. Public Health will continue to monitor and manage the close contacts of the man currently in quarantine over the next 7 days. In relation to our borders, Queensland today has reported 4 new cases of COVID-19, all of which were in quarantine, which is promising news, and public health authorities noting that they've just made an announcement in terms of Cairns will monitor the number of cases today and tomorrow, and will provide a further update on Friday in terms of the circumstances around our border restrictions with Queensland on Friday. Importantly, I'll just make the point that Cairns and Yarrabah regions continue to be declared high risk level 2, and the stay at home order for anyone who's been in those areas on or since 29 July remains in place. A further update in terms of that, albeit that they have lifted their lockdown due to their confidence at the moment. We're waiting on an update from New South Wales, which yesterday reported a record 356 cases along with 3 more deaths. As I've said on many occasions, our thoughts are with the people of New South Wales at the moment. They're going through a very difficult time. The impact that the Delta strain is having in that state is tragic, and with no certainty on when that state will return to a more normal way of living. It was concerning yesterday to hear that 350 people are in hospital and 60 people requiring ventilation, and there have been 89 deaths. I understand the vast majority of those deaths have been, unfortunately, with people that weren't fully vaccinated. Victoria has again today recorded 20 new cases, and while authorities in that state appear to have a good understanding of where their cases are coming from, in the last 5 days there have been 91 cases, and unfortunately two-thirds of those cases, more than two-thirds, have been infectious whilst in the community, which is very worrying. What is obvious is that Delta has changed everything. Victoria and New South Wales are now combating a new health and economic crisis. Vaccination is the key. It will save lives, and importantly, it will reduce the risk of you ending up in hospital, and it will reduce the risk of death. Today I'm announcing a 4-point Delta Shield plan that we're going to put into place immediately. It will involve one, our borders and strengthening the processes that we have there. Secondly, a vaccine blitz. Thirdly, we're going to strengthen testing, tracking and tracing. And 4, there'll be a business support package which I'll say more about in a moment, and we'll have further detail later in the week. But firstly, in terms of strengthening our borders, our restrictions have worked well and they have protected us, but as I've said, Delta is different. We need to learn from the lessons that have unfortunately been played out in other states. We need to continuously review our procedures and strengthen them where appropriate. Our systems work, but what is evident, we're seeing more people now starting to flee other states as well, putting pressure on our borders, but also, as I understand, putting pressure on other states and territories' borders as well. For those people that arrive at our borders and who've previously been rejected and told not to come because they've been in a high-risk area, the on-the-spot fine will increase to $1,557 from Friday this week as soon as the paperwork is in place. That will also extend that same level of fine for anyone that breaches quarantine requirements, and so the current on-the-spot fine infringement is $774.80. It will increase to more than $1,557. Infringements for failing to use the Check-in TAS app will remain at the $774.80, and police will start to issue infringement notices where people flaunt the rules whilst going about our community. Now, we've had an educative approach. Businesses have worked with us, the community's worked with us, and in the main, Tasmanians are doing the right thing, but this is not the time to be complacent, and we will start issuing infringement notices where people blatantly breach those rules. Now, New South Wales will continue to be classified as high risk level 1 for the foreseeable future. The fate of New South Wales is in the hands of the New South Wales Government and the people of New South Wales, but we are going to keep our very strong border arrangements in place. With regards to Victoria, we plan to remain closed to Victoria for at least the next 2 weeks, and potentially for up to 4 weeks, depending on how the situation in that state plays out and while our Delta Shield plan is implemented. So we will have strong border controls in place in terms of New South Wales, Victoria, and obviously we will update in terms of Queensland this week. In terms of our borders, and as I've said on a number of occasions, our laws don't reach to past our borders, and what we've been working on is ensuring that when people are looking to catch a flight or get on the Spirit, that they're provided with information. We're going to increase our notifications at airports. Currently we're in Melbourne and Sydney where we've got staff. We'll be extending that to Brisbane as well. This will also include electronic signage and additional material that will be handed to people before they get onto a flight or onto the Spirit. And I have to say that the Spirit have been doing a great job at this to this point. Obviously, it is difficult when people are challenging the rules, but at the end of the day, our systems are holding up. But we want to ensure that we provide as little dislocation to people as possible. We will do everything that we possibly can, but if somebody arrives here and they have been previously rejected and they haven't accepted the advice in either Melbourne, Sydney, Brisbane or at the Spirit, then we will fine them. It is as simple as that. And that fine will be, as I've said, a doubling of the current infringement notice and more than $1,557. Second part of our plan. We're going to run a super 6-week vaccine blitz. Currently our vaccine program leads the country. However, with Delta we need to do more. And I'd encourage Tasmanians to do what they can, turn up and get vaccinated. Now, as part of our work to further strengthen the state's defences, the Department of Health will commence, as I said, this super 6-week campaign to boost our vaccination rate well into the mid-60% by mid-September. We'll do this by commencing a program to vaccinate college students, 16 to 18-year-olds, from the 23rd of this month, with the timing selected in conjunction with the Department of Education to best suit examination rescheduling. We're going to open our clinics on extra days and we'll extend hours in all state community clinics statewide to target our 30 to 59-year-olds. Pharmacies will also be brought online more quickly, and we're currently engaged with the Commonwealth and with Public Health in terms of that, and the Deputy Premier can say more on that. But it's important that we ensure that Tasmanians can have an opportunity to be vaccinated. This will be on top, in terms of these actions, this will be on top of the 70,000 plus bookings in our system. By lifting our vaccination rates in the 30 to 59 age group, we can bring forward vaccination of the 16 to 29 age group, and we'll open that in the first weeks of September. To do this will require some sharing of resources right across our health system, and the Deputy Premier and Health Minister and the Secretary of Health can talk about that. But again, what we want to see, whilst we have the protection of our borders, the simple message is that what we want to do is to get on and vaccinate as quickly as we can, noting that obviously we need to deal within the constraints of supply. Third part of our program will be to strengthen our testing, tracking and tracing system. In relation to our testing, tracking and tracing, I've tasked the Secretary of Health, along with Public Health, with engaging with their interstate counterparts to understand the lessons from New South Wales and Victoria and to implement any improvements from the experiences of those two jurisdictions in relation to managing the Delta strain. Now, it's good clinical practice, and as it is good clinical practice, obviously Public Health are engaged with AHPPC on a daily basis, and we obviously engage with the clinicians in those states, but there are lessons, and I think New South Wales, unfortunately, are learning them the hard way. We need to ensure that we learn from those challenges that they face, and where necessary, implement what we can here. Already in Tasmania, we have a workforce of up to 200 people available within the state to track and trace should an outbreak occur, and we've spent significant time and resources ensuring that people are ready and able to do that work. But due to the rapid transmission rates and high infectivity of the Delta virus, we're going to move to where we're going to include contracting additional external surge workforce tracers, which will effectively double our workforce should the need arise. Delta is different. I can't stress that enough. As part of this program, it will also include ensuring that our systems and IT support to ensure that our systems can effectively support remote tracking and tracing services and engage with an external surge workforce when it needs to. Importantly, the fourth part of our plan, we know that we're going to need to provide additional business support. I have had some very positive conversations this week with the federal government. I spoke last night with the Federal Treasurer, and later this week I expect that we'll be able to announce a package for those businesses that rely heavily on interstate travel from across the eastern seaboard, bearing in mind that in terms of our interstate visitation, Victoria, Queensland and New South Wales provide between 70 and 80% of our visitation to the state, and obviously New South Wales is out for some time, Victoria for at least the next couple of weeks, and Queensland will review on Friday, but there are impacts that are occurring on our businesses. In terms of the package that we've been discussing, and as I've said, I'll have more detail later this week, but it will be for those key sectors impacted by our border restrictions, being tourism, hospitality, arts and events, and those transport services that rely on high visitation rates such as hire car and coach tours. The support will be available for those businesses which have been impacted from late June, which is when New South Wales first put in place its lockdown. I would hope that applications would be able to open next week, but I'll provide more detail, I would hope, later this week in terms of the shape of that package once we've finalised our discussions with the Commonwealth. I do want to touch on football and in terms of this week's game. Public Health have given significant consideration to the game of AFL that is scheduled to be played in Launceston this weekend between Hawthorn and the Western Bulldogs. It has been determined that given the improved situation in Launceston, the fact that our border with Victoria will remain closed and therefore no Victorians can therefore attend the game, the scheduled game this week at UTAS Stadium will proceed in a COVID-safe manner. Teams are already in COVID bubbles, players are tested up to 3 times a week, and obviously they need to provide a negative test prior to travelling. They'll fly in and out on the day on chartered planes and through the established COVID-safe corridor that has been used in the past, and the teams and the small number of support staff will not have any contact with our community. Masks will be required to be worn at the game, and the crowd will be capped at 10,000. So I'll now hand over to Jeremy to provide more details in relation to the Super 6 vaccination blitz. But before I do, I want to remind Tasmanians that we are at a very critical point. The experience of the 2 major states in dealing with this virus provides sobering information in terms of the risk that is present just over our fence, just over our moat, and it's important that we do what we can here in the state to ensure that we are in the best possible place to ensure that we can protect the health and safety of Tasmanians. I would again remind Tasmanians, please do the important things. Stay on top of COVID, follow COVID-safe behaviours, check in at premises, get tested if you're unwell, and importantly, don't wait. Take the opportunity to vaccinate when you can. I'll hand over to Jeremy.
Thank you, Premier, and it's great that Tasmanians are continuing to respond to the need to be tested, with 3,690 presentations over the past 3 days, including 1,110 presentations just yesterday. Yesterday we had 1,263 tests processed in the laboratories, and we already have more than 300 appointments for today at our testing clinics in Launceston and Hobart. There are hundreds of appointments available, so if you need a test, please book one online at www.coronavirus.tas.gov.au or ring the Public Health Hotline on 1800 671 738. As we remind Tasmanians every day, the best way to safeguard yourself, your loved ones, friends, your local community is to get vaccinated. As of last night, 353,591 doses have been delivered in Tasmania. This includes more than 182,000 at our state clinics. As of last night, close to 51.5% of eligible Tasmanians over 16 years have received 1 dose, and over 28% fully vaccinated, and this is fantastic news, and I thank Tasmanians for supporting the push to vaccinate our community. But as the Premier has said many times, and as Delta has shown us, we need to do more, and that is why we're announcing today a Super 6-week campaign to boost our rate of vaccination well into the 60% range and to help push reaching our 70% and 80% targets more quickly. The Super 6 program will be part of an intense period of work for our Health Department and COVID-19 response to further strengthen Tasmania's capacity to respond to the Delta variant and the risk of outbreaks that unfortunately we are witnessing in the mainland. The vaccination uplift will involve, from Monday the 23rd of August, a campaign to vaccinate our college students, 16 to 18-year-olds. This date has been selected through our work with the Department of Education as the best date to suit the timing of end-of-year examinations and assessment. We will also extend the days of operation and hours of operation of all our state community clinics statewide, and will run clinics dedicated to lifting the vaccination of our 30 to 59-year-olds. This target age group, and particularly the 30 to 39-year-olds, have been shown by recent modelling to be a key factor in the ease of transmission of the Delta variant, and that is why we are going to do a very big push to get this age range vaccinated. This uplift is on top of the 70,000 plus bookings that we already have in our system, and we will continue, of course, our priority aged care, disability care and priority workers or those with underlying medical conditions. But to strengthen Tasmania's reinforcements for Delta, we need to take this vaccination step. We'll provide further information on the Super 6 campaign later this week, as the Premier said, as we finalise our logistics and the resourcing. Next Monday, the first stage of our community pharmacies will offer dose 1 and 2 AstraZeneca to the over 60s to help fill the gap for that age group, and the fact that the state clinics have moved to Pfizer for dose 1. We continue to work with the Commonwealth to bring on more community pharmacies, and we'll look at the expansion of their age range and vaccine types as the rollout progresses. The Tasmanian guidelines reflect the fact that AstraZeneca is the only vaccine available from the Commonwealth to community pharmacies. The TGA advice for states like Tasmania, where there is no widespread community transmission, is that AstraZeneca is the preferred vaccine for the over 60 age group, and that is what the guidelines reflect. From discussions with the Commonwealth, it is our understanding that when Moderna is available for distribution, this will also become available to pharmacies. However, this is most likely to occur in October. The postcodes chosen for the first 2 tranches give priority to pharmacies that are in the areas where the take-up by over 60s is lower. This group includes vulnerable Tasmanians, and this reflects them being able to be prioritised rather than turn on a pharmacy in an area where, for instance, take-up is well over 90%. As the rollout progresses, we will continue work with pharmacies, with additional pharmacies being added as more postcodes are opened up and as supply becomes available. The opening up of the first pharmacies is something to be celebrated, and thank you for all those that have put up their hand, and eventually all of the pharmacies that are approved immunisers can and of course will be involved. While getting vaccinated is a personal choice, I can only absolutely urge those that are yet to be vaccinated or remain hesitant, please have a chat with your GP. There are bookings right across the state, so please book now, don't wait, vaccinate. And I want to reinforce the messages that the Premier has highlighted around the seriousness of the Delta variant, which is why we're taking these key steps. I also wanted to add just a thank you to Tasmanians that have testing, recognising their symptoms, getting tested, vaccinating themselves. It's a tremendous effort. We are leading the country, and we want to obviously continue that as we continue the Super 6 push. But I also want to thank very much all the people involved with the vaccination effort and the testing clinics, right across the public service, our police and emergency services, our health department, and of course those working very hard in our Department of Communities. Those staff in our quarantine hotels are doing just such a tremendous job, and as a minister responsible for a number of portfolios, I'm immensely proud of the work that our public service are doing under very challenging circumstances. Thank you. I'll now hand over to Dr. Veitch.
Thank you, Premier and Minister, and good morning. I'll just make a few comments and then be happy to take some questions. I'd certainly like to reiterate what both the Premier and the Deputy Premier and Health Minister have said about the absolute importance of going out and getting vaccinated. We've seen what's occurring in New South Wales. We've seen deaths reported every day. And we've also noted that the majority of the people who have died have been unvaccinated. That is very powerful evidence that if you get vaccinated, you're much less likely to die of COVID, much less likely to end up in hospital. New South Wales is experiencing those awful outcomes in numbers because of the widespread spread of the Delta strain in their community. So it's really emphasising to us how quickly this gets around, how much harm it causes, and how we must take every opportunity to get vaccinated, whether we're going to a general practitioner, whether we're going to a state-run clinic, or increasingly over the coming weeks going to a pharmacy and getting the vaccine. That's going to prevent the worst that can possibly happen to you. So the New South Wales situation is obviously grave, and that's a principal driver behind some of the measures that the Premier has mentioned. It was also, of course, the reason why we had a person in Tasmania last week with coronavirus. They were infected in a high-risk setting or a high-risk area in New South Wales. Our contact tracing team leapt into action when that occurred late last week, and the contact tracing process has gone well. We know that we have, I forget the numbers from yesterday, but I think we totaled at around about 180 primary and secondary contacts, maybe it was 160 something, primary and secondary contacts associated with that person's movements into Tasmania and out of Tasmania. And we're now coming up to the time when the first of those people in quarantine will have done 10 days in quarantine and are due for their exit testing. So what will be occurring from tomorrow and through the weekend is tests that are done towards the end of quarantine of those people who were in quarantine because they were deemed contacts of some sort of the gentleman who was infected. So I think it will provide Tasmania with considerable reassurance as we see those tests come back negative over the coming days. Many of those people have already had an early test in quarantine and have been negative, but the critical one is the one that occurs towards the end of their time. One or two people who've been subject to quarantine as a result of being in contact have reported symptoms. They've gone and got tested and they've come back negative. So it's all good news so far, but we are certainly looking forward to the middle of next week, by which time most of those people will have completed their testing and their quarantine. And that's when we'll be able to say we're past this. I also want to acknowledge the Premier's comments about boosting and reviewing our public health response capacity. That's something we always do along the way, and we take lessons not only from states such as Victoria and New South Wales that have had huge burdens of contact tracing to do, but we're also in discussions with colleagues in smaller states that have smaller capacities to respond, states like the Northern Territory and South Australia, so we understand how states that are more analogous to our sort of situation and workforce are responding. And there have been a number of reports produced by a number of agencies, and we do look at these reports, and now really, as we look to having a response capacity that's in place for a year or two, not just the relatively short term, it's a great time to be discussing what the best quality of public health response is. And people are doing that all across Australia. The Doherty report from last week was a very important stimulus to all of us to look at our capacity to do that. So I'll just briefly touch on the jurisdictions and their circumstances. New South Wales, I've not heard the numbers from today, but we heard yesterday that with 350 or so cases, they're weeks or months away from getting out of their awful circumstances. So as the Premier said, there's no foreseeable change to our border arrangements with New South Wales. Victoria has been seeing between 10 and 20 cases per day, principally in Western Melbourne, but quite extensively across Western Melbourne, and with quite a number of exposure sites and a number of people who have been in the community while infectious. That number's dropping, but I think we need to take a very cautious process with our nearest neighbour, and that's why I've recommended that we don't consider a significant change to the border arrangements with Victoria for at least 2 weeks. Queensland is looking more favourable. They have 2 clusters, both of which appear to be contained. One in far north Queensland around Cairns, where we'll have heard that the stay-at-home order was dropped today. And also they've been managing a cluster in southeast Queensland, 11 local government areas around Brisbane. We will again take a cautious approach to that, and we will review the border circumstances based on the epidemiology of cases over the next 2 or 3 days before providing further advice on movements to and from Queensland.
Questions? Just on the Cairns Northern Queensland issue, what's the reasoning behind keeping the stay-at-home order in place for people who'd already travelled to Tasmania from there when we're no longer having the border closure to that area?
We still have a border closure to Cairns. People can't come into Tasmania from Cairns for the time being without being required to have an exception to come in from the Deputy State Controller and then go into home quarantine or a suitable premises. So we can look a bit separately because the people coming into the state represent risks that might happen in the future. The people who are already here are people who reflect the risk that occurred when they were back in Cairns. So we look at them both in a slightly different time frame, but we need to try and keep this neat. We don't want to keep restrictions in place longer than is necessary, but we also need to be sure that the messages we communicate to the public are as simple and straightforward as possible. So we'll deal with those both things. We'll think about them separately, but we'll communicate about them together.
Can you talk us through the decision regarding vaccination of college students as well?
The decision to vaccinate college students arises from national recommendations that they're a significant group in terms of transmission, particularly amongst their own age group. And they're really the age group where there's beginning to be an increasing risk of contributing. I'll just wind back. People between the ages of the late teens and around about 40 are a very mobile group in the population. So they are people that we know from the experience of other jurisdictions contribute disproportionately to the spread of disease. So you'll have heard that a week or so back we announced that people over the age of 30 will be being targeted for vaccination as a Tasmanian initiative. And this is really the other end of that age group. And obviously being in colleges, they're an accessible age group and there's an established way of reaching out to them. So it's that they do need to have access to vaccine. If we do it now, it gets in a bit before they're under the pump with their exams at the end of the year.
That leaves the 19 to 29-year-olds in the kind of grey area though. When will that be prioritised?
Well, it's clearly the gap that we'll need to prioritise when we've got the vaccination, enough vaccines to be confident that we can open up bookings to that group.
And how do you rate the level of risk at the football match? Do you think it's pretty watertight?
Look, I wouldn't have provided support for a football match occurring if I thought there was a risk to Tasmanians. We put some limits on it, so we limit the number of people who are going to the match to 10,000 people. We restrict it to people who are in seats, and 10,000 people is less than the seated capacity, so it provides a bit of an opportunity for room. We're also asking people to wear masks, or requiring people to wear masks, and to practice all their COVID-safe behaviours, including checking in when they get there. I think that's a good suite of mitigations. Nothing is risk-free, and if we were unfortunate enough to have a case of coronavirus, for example, diagnosed between now and then in the northern Tasmanian community, I would be afraid that Footscray and Hawthorn will be playing somewhere else in all probability. But let's hope that doesn't happen. I think the risk is pretty well mitigated.
I just want to double check the college students. That's not just eligible college students, it's all college students.
I might just ask the Secretary to provide the detail of it. I was happy to provide the rationale, but the implementation is really complex and there's a great group of people who are doing the implementation of all this stuff.
To the Secretary?
Thanks, Mark. So just to explain in terms of the rationale for the groups of people that we have chosen for the Super 6 vaccination campaign, I should say. So the Doherty modelling that we've received in recent weeks have certainly called out the 30 to 39 age group as of probably the highest priority, and that is why a couple of Fridays ago we introduced the early introduction of the 30 to 39s to the Tasmanian vaccination rollout. The Super 6 campaign is going to focus not just on the 30 to 39s, it is also going to go up to our 59, so 30 to 59 years. And that is really, we are watching the percentage of vaccination rates for those age groups, and I would really like to see, particularly for our 40 to 49s, our 50 to 59s, those rates to really increase. So we're probably sitting in the 40s or 50% for those groups of first dose vaccination, and we really need to lift those up. So this campaign is going to focus on pushing towards that 30 to 59 group to put in extra bookings. We will run and provide further information at the end of the week on those specialist clinics that will really be focusing on that age group. Now, around the college end of the spectrum, so our 16 to 18-year-olds, we have been working over the last few weeks with the Department of Education to examine the right time in the year to actually bring on our college population. So in terms of examination or assessment and really trying to pick, it's difficult to always get the best time, but the advice is that from the 23rd of August, if we commence that campaign, and we'll be doing that with the assistance also of our school nurses who are in our schools, who know their student populations, and we'll also be providing Department of Health support and also the logistical support to actually get those vaccines out to the college students.
Do we have enough vaccines, or do we have enough on the way to actually vaccinate all people in those age ranges in Tasmania in that period?
So in this period, we will have enough vaccine to do a really big lift. So to get us into the 60 percentiles in terms of our over 16 age group. And we are currently talking to the Commonwealth, and we'll examine the potential whether we do need to bring forward any vaccine. But on the advice that I've seen this morning, and I've got teams that are going through all of the numbers and now readjusting to get this Super 6 campaign in as part of our Delta strengthening effort. So it's absolutely critical that we take this time, particularly while we do have these border arrangements and with both New South Wales and Victoria to really focus on vaccinating. So we do have the stock. I'm confident that we have the supply, and we also have a very good relationship with the Commonwealth team in terms of actually pulling forward supply if we need to have that conversation.
Is that the target? Is the 60% the target of this Super 6 vaccine?
Yes, so we are attempting to target lifting into the 60s, and I wouldn't just call it 60, we'll try to push as far as possible into it by mid-September, and that means that we've previously talked about targets for both our 70% and 80%, and we're currently reworking our numbers on that, but trying to bring those forward as quickly as we can.
And what do you say to somebody who says the vaccine doses would be better used in New South Wales?
So, and certainly in terms of the national rollout, it has always been the basis that we have had a per capita distribution of vaccine from a Tasmanian perspective, and we've moved from the very beginning where we had 1,160 doses in a week, and we got those 1,160 doses out. Every single week we have attempted to use every little bit of vaccine that comes into Tasmania, and we've had a very low wastage rate. So we're not sitting on piles of vaccine that we could potentially redistribute. We also have a very vulnerable population in Tasmania. We've seen what has occurred last Thursday with the Delta case that we had reported in quarantine, and it really does reinforce for everyone in Tasmania just the critical importance to vaccinate. We will do our absolute best to keep our borders as strong as possible, to have our health system prepared. We are going to strengthen again our tracing component and our testing component, learning the lessons of what we are seeing on the mainland. But we absolutely do need to use every vaccine that we get in Tasmania and get them into Tasmanian arms.
Just in relation to the pharmacies, the initial ones coming online, what has been the reason that pharmacies in those particular locations have been chosen to be the first to be dispensing the vaccine?
So we have targeted particular geographic regions where we've had concerns probably about the over 60 take-up rate being lower than what we are seeing in other geographic regions. So, for example, we have selected in these first postcodes, we are then going to cover some 50% of the postcodes that have that lower penetration in our over 60s. If we had just opened up to random geographic areas, we may be turning on pharmacies, for example, that we've already achieved an over 90% vaccination rate. So we are trying to equalise across Tasmania and make sure that those areas that perhaps haven't had as great an opportunity, potentially located further away from a state vaccination clinic, or may not have as many participating GPs involved. So that's why we're geographically targeted, and look, we will really celebrate community pharmacies coming on board on Monday, and are committed to working with the pharmacies to make sure that we can roll them out as quickly as we can.
And in terms of bringing other pharmacies online, is there a timeline for that? And do you know how many you'll be hoping to bring online?
So we have 11 that will be starting up on Monday. We've got a further 14 or 15 that will be joining in the week coming after that. And as part of our Super 6 campaign, we will examine the remaining pharmacists that are already authorised and approved and select those geographic areas we can turn them on. We also need to match it to the supply of vaccine that's coming into the state. So the AstraZeneca vaccine, which is what is approved from the Commonwealth to be supplied to pharmacies.
Next month, the mandate for aged care workers to have at least their first dose of vaccination comes into effect. I know this is a Commonwealth matter, but do you have any latest up-to-date figures around vaccination rates for aged care workers in Tasmania?
So we've probably talked about various vaccination rates, and anywhere from what is reported by the self-reporting tool that's managed by the Commonwealth. I've seen anywhere from the 30 to up to 50% range. We've done our own work that indicates that we think it's closer to the 70%, approaching 80% in some areas. But what we are doing over the next 4 weeks is that we have scheduled and worked with the Commonwealth to have in-reach in every single residential aged care facility in Tasmania. So they will all receive a visit. There will be that opportunity for any last staff members that are not vaccinated to be offered a vaccination, and we'll also pick up new residents that may not have had the opportunity to be vaccinated.
And how
I've got
quick-
one question for Donna Adams and then we'll go to the Premier.
We just heard from the Premier that we've had an education process for people around checking in using the app and so on when they go to places where that is mandatory. Now they'll get fines if they don't do it, how are you going to police that?
Tasmania Police has taken an educative approach with the Check In Tas app. We've seen high levels of compliance, and that's really pleasing to see that the community are actually heeding the message and the importance of actually using the app. What we also have is we've had members of the public who have actually reported breaches of people not using the app, and again we've taken that educative approach so people understand the importance. It's now really important that people understand that this is a critical tool for our contact tracing, and Tasmania Police will play a role where it's required. We'll support the Department of Health in issuing infringements for those that are failing to comply.
Practically, how are you going to do that? Is it around police doing sort of patrols of shopping centres, or people supplying evidence of people not checking in? How I'm just curious, how is that actually going to be, I suppose, monitored?
At the moment, WorkSafe Tasmania will work with Tasmania Police and other key stakeholders to actually visit businesses to ensure that businesses understand the importance and the key role that they play. That's the first approach that we will take. I think it's again important that Tasmanians get the opportunity to understand that this is an important part of our defences in terms of protecting us from any COVID-19 outbreak. So that will be the first strategy in the enforcement pathway.
In terms of the tougher border measures, will more police resources be put towards policing that?
We've had police working with biosecurity and airport security for over a year now. We've certainly ensured that we've got a strong police presence at the borders. It's important. Border control is really one of the first lines of defence for us in terms of protecting Tasmania against any outbreak. And we'll continue to conduct a high visibility presence at the airports and at the Spirit of Tasmania.
Okay, questions for the Premier?
Thanks, Donna.
Can you explain in a bit more detail what the support package for tourism and hospitality businesses and those affected by border closures will look like?
Well, I knew you'd ask that question. We're currently working through that, negotiating it with the federal government. But obviously there will be businesses that have been impacted as a result of the lack of interstate visitation. Some businesses more than others. I think as I walk through this city or Launceston, there are restaurants and hotels that are doing very well. There are others that have been impacted because their market is, broadly speaking, interstate. The package will be by application. The rules and the amount of funding will be provided, I would hope, later this week.
Do you imagine it'll look like the JobKeeper scheme we saw last year, and more like the disaster relief payments we're seeing at the moment?
It'll be more like the disaster relief payments. It'll be targeted grants to businesses that are impacted, and obviously there'll be measures in place in terms of those businesses that have a number of staff and those businesses that may be sole traders. But those rules will provide more detail later this week.
And is it likely to be a 50% contribution from the Commonwealth, 50% from the state, as we've seen in other packages recently in other states?
Look, I'm working very closely with the Commonwealth at the moment, and I'm confident that we'll have a package that will see each of us meeting our necessary obligations. But I'll have more to say later in the week. But as I've said, it's been a positive, constructive discussion with the Commonwealth. They are cognisant of the fact that these big states shutting down have second-order flow-on impacts, and the discussion that I had last night with the Federal Treasurer was very positive, but we'll have more to say later this week.
Is it something you're now trying to work into the budget that's coming out quite soon?
Look, in terms of the budget, every year we have flexibility built into the budget. This package won't appear in the budget, but as I've said only a couple of weeks ago in this room, that in terms of COVID response, we built in sufficient flexibility into this year's budget to ensure that both in terms of our health response, but also in terms of those other responses that we might need to make, that there is flexibility available for it.
And you don't have a dollar figure for the package yet, like tens of millions or something?
Look, it will certainly be tens of millions.
Twiggy Forrest has raised concerns about the absence of mention of environmental or animal husbandry or welfare concerns in the JBS bid for Huon Aquaculture. Would you rather see the company remain in Australian hands, or you still think that JBS is a good bidder?
Well, look, I said the other day, we live in a global community, let's be clear. And at the end of the day, as Premier, obviously I would prefer, Tasmanians to continue to own this business. I made that perfectly clear the other day, but we live in a global community. I haven't seen the detail of what Mr Forrest might have put forward, but this is ultimately a matter for the shareholders of Huon Aquaculture.
It's also a matter for the Foreign Investment Review Board. Would the state be likely to make any submission to that process?
Look, whenever there's a review by FIRB, we always make a submission.
Mr Forrest has called for any takeover by JBS to be contingent on them agreeing to uphold higher animal welfare and environmental standards. Is that something you would support?
Well, again, look, I haven't seen what Mr Forrest has said, but I've made the point on a number of occasions. We have increased regulation. We have separated and made it independent of government. We have a highly regulated sector at the moment. And I would expect any purchaser of Huon Aquaculture, in fact any business in this space, that they would abide by the law. And those laws are very strict.
All good? Thanks, Glenn.